and they're worth sacrificing for. So I think for me to go into Congress, I was very frustrated with the government's interference with the patient-doctor relationship. I mean, even as a nurse, there was too much of a regulatory administrative burden. We complained about that as nurses, even before we had electronic health records. So from nursing to medicine, I saw the same, government imprint, government regulation, government administrative burden that prevents us from being able to have the right conversations with our patients, being able to bill accordingly, to do the type of preventative care that we need to help people be healthier. But it was too much government interference. And I figured, I can complain on the outside, which I did. I went to Congress, I advocated for things. So I could do it from the outside, or I could do it from the inside. And I said, well, I'm either at the dinner table or on the dinner table, and I'm tired of being on the dinner table, so I better be at it.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential. And here's your host, Jeff Crank.
Well, thank you for joining us for another episode of American Potential. As America pauses to honor Veterans Day, we wanted to take time and reflect on the history of this day and on one veteran who's taken her commitment to service from the Army to the halls of Congress. Veterans Day was originally known as Armistice Day, and the holiday began as a tribute to the end of World War I on November 11th, 1918. And it was later renamed in 1954 to honor all American veterans. One such veteran who served 24 years in the Army initially thought she'd become a teacher, but after an accident shifted her path, she joined the Army, rose through the ranks, and ultimately became a doctor, and even served as Iowa's Director of Public Health. Today, as a member of Congress, she remains a strong advocate for veterans, healthcare reform, and policies that protect Iowa's values and foster economic growth. I want to welcome Congresswoman Mariannette Miller-Meeks, who represents Iowa's 1st Congressional District. Congresswoman, thank you for being with us.
Thank you so much, Jeff, and I'm delighted to be with you.
Well, great. So first I have to ask you, I don't know if this came from your staff or if this was came off the internet, but it says here that you can run on McDonald's filet of fish and a Diet Coke. Is that right?
Well, I would say I know just about where every McDonald's is in my district, and I have no financial interest. I don't drink coffee. I love how it smells. I make it for my children, which is hard to make it when you don't drink it. But right. So Diet Coke is my beverage of choice. I've increased it. I've decreased it. But I try to have more water than Diet Coke. But yes, especially during certain times of the year, Diet Coke is a staple.
Is this what you're referring to right here? Because
yes,
this
sir, that is it.
Okay.
I prefer the can or the fountain drink. A good fountain drink is phenomenal. Less so with the plastic bottles.
Gotcha. Well, listen, I'm a diet. Everybody who knows me, I'm sure my staff is laughing right now because I'm a Diet Coke nut. Now, I don't know. Now, the filet of fish, I don't know. I'm kind of a hamburger guy, but you do the filet of fish.
Well, I'm Catholic, so you had to have fish on Fridays. So it was fish sticks. And then when I got older, it became a fish fillet. Gotcha.
Okay. Well, great. Well, listen, first of all, I want to thank you for your service in Congress, but certainly also want to thank you on this Veterans Day for your service to our country in the United States military. So I want to start out by thanking you for that. And if you could share a little bit about your personal story, of wanting to be a teacher, but ultimately sort of joining the Army.
Well, my dad was career Air Force, so he was enlisted in the Air Force, and my mom had a GED. Both my parents worked my entire life. My father, because he traveled around the country, sometimes he did nuclear power work. So the Army borrowed him occasionally at Fort Belvoir and then in Sundance, Wyoming, to shut down a nuclear power facility. But my parents traveled a lot from military assignment to military assignment, but I mostly grew up in Texas. And my parents were very smart. Like many people in their generation, they were self-educated. They were very intelligent. They were very hard workers. Often my dad would have extra jobs on the weekend to support the family of 8. And, they would talk about college. And I knew that I wanted to go to college. I remember very distinctly hearing my parents say, well, so-and-so's in charge and they're the boss because they have a college degree. So even at a young age, I figured I needed to go to college. Otherwise, someone was going to be the boss of me that didn't know anything, which may describe Congress. I don't know. But at any rate, when I was 15, I was burned in a kitchen fire. My dad was stationed at Wright-Patterson. At that time, we had gotten out from the snow. And like many large families, the kids actually take care of the younger kids. So, we cooked, we, did laundry, we cleaned, all of those kinds of things. And so my brother had come in from the snow, put bacon in a cast iron skillet that had grease in it, put a lid on it, caught the kitchen on fire. And since I was the one downstairs, we were in military housing, I tried to put it out, and my younger brother and I got burned. Now, until that point in time, I wanted to be a teacher. I was good in school. I was good in science and math. And I thought it was something that my parents would really like, but they weren't very encouraging when it came to teaching. I remember my dad saying that the school system was against poor people. And so when I was burned, though, I knew the thought came to me. And at that time, I knew it's what I had always wanted to do. And it was, I'm going to be a doctor. And it was not because of the doctor. We were in isolation. It was because of the physical therapist, who was very kind, even though having treatment for burns and removing the eschar is extraordinarily painful. So it was very painful, but she was a very compassionate, wonderful lady. And so I came home from the hospital, told my parents that I was going to be a doctor. And my parents, not having gone to college, not knowing how to help a child go to college. My 2 older brothers went in the military, one in the Army in the Green Beret, the other in the Army into Vietnam, and then came out from Vietnam. And we know how Vietnam veterans were treated. So he did not last long in the civilian space until he rejoined the military and joined the Marines. My older sister wanted to get married and have kids. So here you were. I'm actually the smallest of the family. You get a kid who says they want to be a doctor and you don't know what to do with that. And my parents didn't know what to do with it. And I said, well, if I'm going to do this, then I have to make it happen. So my dad gets reassigned back to Lackland Air Force Base in San Antonio. And I decide that I'm going to put myself through school. And so I leave home at 16, enroll in San Antonio Junior College. And I figure that if I go into nursing, I can have a job where I work at night and I could put myself through med school. So I started community college, and then my dad was in the Air Force. I was very comfortable in the military. And I really kind of didn't know how to do civilian life very well. I remember having to figure out where I had to go shop for groceries because I'd gone to the commissary my entire life. And so I just said, well, if I join the Army, I can enlist in the Army and maybe they'll help with education. And I liked being in the Army. I liked military bases. I was very comfortable with it. And I think it's noble to want to be in the military. And as I said, my brother had served in Vietnam. And it was important to be able to have this life of service. And so I enlisted when I was 18 and then was able to work and get a degree in nursing. And when I got my degree in nursing, they promoted me to lieutenant. And then I ended up spending 24 years in the military, 9 years active duty, the rest in the reserves. And then one of the great things about my Army is that being in the Army is I met my husband when I was assigned at Walter Reed, when I was a fresh lieutenant, and he was an E6 working on opposite sides of Walter Reed. We met in the basement of Walter Reed. He got an Article 15 for dating me, paid a $50 fine, and now we've been married 41 years. So I think it was, I was comfortable with the military. I liked the culture. I liked the people. I liked this, being your individual best, but being part of a team. And that really exists in the military. And it doesn't always exist every place else. And I truly believe, we got your six, we got your back. And that
Right.
military members take care of other military members. And it's why all of us have reacted the way we did with the disastrous and confident withdrawal from Afghanistan and leaving behind, our allies, both our European allies, our Afghan allies, leaving, people who worked in the embassy, people who helped our troops, who took bullets for our troops. We feel a certain way about those things as military members.
Right.
And interestingly enough, I was reflecting back on on how our affiliation to the Constitution, because we've sworn an oath to protect it, and why that means so much more for people that were in the military than it does. It's not just phraseology for us. It really means something. And I was reflecting on all of the things that have happened at this particular time of year, and a lot of lies and misrepresentations. And I said, I was willing to put my life on the line for somebody else to lie about us.
Right. Now, how did your dad was in the Air Force. How'd you pick the Army? Really? I mean, you kind of talked about that, but how did your dad feel about that?
Well, I should have picked the Navy because I look better in blue than I do OD green. But, my dad was okay with it. As I said, 6 siblings served in the military. There was one Air Force. One of my younger sisters was Air Force. The rest of us were Army. And so I think he was just proud to have children that were willing to serve. And I think he also thought of it as a career opportunity, and we had a job, so we weren't going to be dependent on him. We weren't going to be living in a basement somewhere.
Right. Now, after you served, let's talk a little bit about that service. I mean, I want to get into the fact that you went into private practice and those sorts of things as well, but I want to talk a little bit more about your service. I mean, you talked about the importance of service, and I think that comes, as you said, from a military family that was kind of ingrained in you. Talk about that on this Veterans Day, how important it is that we have people who are willing to sacrifice. I mean, it is a big sacrifice. Even honestly, even if you never see combat, going into the military is a big sacrifice for your family. For just, your family moves around all the time. You're gone a lot. I mean, it is a giant sacrifice to serve our country in the U.S. military.
It 100% is. It's why when we had the National Defense Authorization Act, that I had, some of my constituents were not happy that I voted for it, but I voted for it because there was a 5.2% raise for our junior enlisted. It was the largest raise that our enlisted had had in decades. And I think people don't understand the sacrifice and the hardships it is to serve in our military. I have tremendous respect for those people who are willing to raise their right hand and serve. I think that people should go out of high school and go into the military, go into service. I know that there's a lot of thoughts on that, but you don't have to go into combat. And you're correct. Whether or not you're in combat or you're in peacetime, like in the Cold War, it is a challenge to serve. You're moving your family around. As a matter of fact, until I moved to Iowa, I never had been in a place more than, a couple of years. And Texas, we had been there, several years, but it wasn't like, 10 years in one stead. It was 2 years, then 2 years or 3 years someplace else, then back for 2 years. And so when I moved to Iowa to do my residency in ophthalmology, and I was in the reserves at that time, Iowa felt like home. It was the place I belonged, and I've stayed there. But it was I had never been to a place. So when people say, where'd you grow up? Or, did you know this person from elementary school? I never had any of that. Yeah. You don't have those long-term connections. So it truly is a sacrifice to join the military. I think more people should do it. We know only about 1% of our population now is in the military. But there is not a better way to build those values and support for your country and your nation than in the military. And that's regardless of political party. We do a lot of work together in a bipartisan fashion. The 4-country caucus, which is bipartisan members of the military.
Yeah. Well, and I think, you grew up an Air Force brat, as they're called, right? My wife was an Army brat. She grew up, and the sacrifice that you make moving from place to place, never, as you said, never have a real home and be there for very long, and you don't build those bonds in school. But also, the service member goes to work. They show up and they have a place to go. It's the family that's left to hang the pictures on the wall and figure out where the basics change is and those sorts of things, right?
Absolutely, 100%. It's truly a family endeavor, and I have tremendous gratitude and appreciation for those who serve in our military. Yeah,
no question. Now, after you served in the military, you were 24 years of service in the Army. Then after service in the military, you went into private practice. Talk about that. Talk about the transition, because that's something that a lot of folks have to deal with as well, as getting out of the military, transitioning into civilian life.
Well, I think one thing is that you learn some tremendous skills in the military. And these are skills that will carry you through the rest of your life. So one is this, strive for excellence. So individual excellence, but how you work as a member of a team and how you're focused on a mission and accomplishment. One of the things that you'll find about people that have served in the military is that they want to get things done. They're problem solvers. They're creative. They improvise because they're focused on achieving a mission. So you may call them goal-oriented. You may call them problem solvers, solution-oriented. But that doesn't actually exist every place in society, whether it's in the United States or abroad. And so those are skill sets that will carry you through no matter what life you have. The transition can be extremely difficult, especially for people who are in the military as reservists or National Guard, and they're deployed because they don't come back to a unit or to a military base. They go back to a community which may be ill-equipped to handle what they went through, especially if they're deployed in combat. So I think that, the transition and what we're doing now in Congress with the TAPS program, with transition out of the military, support for veterans, what we're doing for, we've done that both at a state level with our home-based Iowa initiative, but also at the federal level on jobs for veterans, expanding the GI Bill to be used not only for a 4-year degree, but for a career pathway or a trade. I think those things are extremely important to help people transition out of the military. And then to make sure that they have, brain health, well-being services, not only their physical health, but also their mental health, that they have access, whether it's in their hometown or whether it's at a VA facility, that they have access to that. So I think all of those things are very important in order to support our military and help them to transition out of the service. But just because you don't have a job description or a military occupational specialty in the military that you see readily transparent into the civilian world, you have a skill set that very few people have. And it's just reinterpreting that skill set to how it can be utilized in a civilian job. But I just think some of our best employees are people who have served in the military, and they know how to get up on time.
Yeah, that is right. They do know how to do that. That's right. Why'd you decide to run for Congress? I mean, after you served in the military, went into private practice, what made you decide to run for Congress?
My husband asked me the same thing. So I was a very successful doctor. I had a growing practice. I brought 2 ophthalmologists into our practice. So I had a growing practice. My patients liked me. I say I go from a job where 99% of the people liked me and I had very high patient satisfaction scores to a job where 50% of the people hate me. But I think why it is a life of service. So when you've been in the military, you're used to serving, you're doing things for the betterment of, your not only yourself, but for your brothers and sisters in arms, for the military, for your community, for your country. You have values that you think are very important to uphold and they're worth sacrificing for. So I think for me to go into Congress, I was very frustrated with the government's interference with the patient-doctor relationship. Excuse me, even as a nurse, there was too much of a regulatory administrative burden. We complained about that as nurses, even before we had electronic health records. So from nursing to medicine, I saw the same, government imprint, government regulation, government administrative burden that prevents us from being able to have the right conversations with our patients, being able to bill accordingly, to do the type of preventative care that we need to help people be healthier. But it was too much government interference. And I figured, I can complain on the outside, which I did. I went to Congress. I advocated for things. So I could do it from the outside or I could do it from the inside. And I said, well, I'm either at the dinner table or on the dinner table, and I'm tired of being on the dinner table. So I better be at it.
Yeah. Well, and as you look at those challenges in healthcare, I mean, it seems like, and we talk about this all the time on the podcast, Many of the challenges are created by too much government interference in the marketplace, into the doctor-patient relationship. Any thoughts on that?
100% agree. There's two places where you see cost higher than the inflation, and that's higher education and healthcare. And that's because we don't have true competition. We have a guaranteed payment. We have third-party payment. So there's a variety of things that can be done that we have passed. Lower cost, greater transparency is a bill that we passed in the House that we would love to see passed in the Senate. And it may be that the makeup of the Senate has to change for us to get this passed. But there are ways that we can introduce more competition, more transparency. We can put patients in charge, help patients to make choices and better choices. So there are a variety of things that we can do that ultimately will help bring down costs, but still afford people access to high quality health care. And I think that it's important that we do that.
Well, and on this Veterans Day, let me ask with the Veterans Administration, I mean, that's been one of the challenges that I think veterans have faced is, they want to be able to choose where to get their health care. For many, a VA facility is a great option, but for many others, they'd rather get community care. If you're in a very rural area, community care may be really your best option by a long shot, and maybe your only option, really. The Mission Act was passed during the Trump administration, but it seems to me we need to move more into the areas of providing more choice for veterans and have it be their decision rather than the VA's. Your thoughts?
I could not agree with you more. People are going to think I had you plant this question for me, but
we didn't talk about it, I promise.
No, we did not talk about it. No, it's one of the things that I have been very focused on as chair of the health subcommittee of the House Committee on Veterans Affairs is on community care. And what I have found is that the VA really doesn't want, community care. They're trying to limit community care. From my standpoint, if you're eligible for care at the VA, you should have the choice whether you get care at the VA hospital. And we have two excellent VA hospitals here in Iowa. We have, two phenomenal facilities. I can't say anything bad about those facilities. They're really terrific. Our clinics do a good job as well, but people don't often live close or they can't get in on time. And, the answer to you have to be seen within 30 days, have an appointment within 30 days or live within 40 miles. The answer to that isn't on 29th day, you call a veteran back and say, oh, we can't get you in. So, we have 30 more days. That's not how you implement the Mission Act. So we continue to work hard to get the deployment of community care to make sure veterans don't have hurdles, but it is veterans' choice. It is a veteran's choice in order to receive community care, and there shouldn't be obstructions to their. And I was one of those providers. So I was a community care provider, and my veterans loved having me take care of them, and I loved taking care of them.
Yeah. Well, yeah. And it seems like the VA on many occasions is just trying to hold on to their jobs and their sway over those decisions. And it should be up to the veteran. The veteran should have that choice about where they want to get that care and what's best for them. For sure.
Yes, sir.
Yeah. So,
I agree.
Yeah. How did your military experience prepare you for the challenges of Congress?
Well, I think one of the things the military that we all are used to, and that is, hurry up and wait, dark 30, hold the phone, roll up your sleeve and drop your, what. But so there are things that we all go through. But I think most importantly, in the military, you learn that leaders aren't titles, that leaders are people who inspire, motivate, persuade. There's a person of such character and integrity that you want to follow them. It's not just a title or not just a rank. And you learn that in the military. And we see that through our enlisted ranks, our warrant officer, and as well as our officer ranks as well. You learn resiliency. You learn to adapt. You learn to improvise. You learn to be your excellent best and to be part of a team. And those things are not mutually exclusive. You learn to be an individual with your individual thoughts and how those individual thoughts can help contribute to that mission. And so these skill sets that you learn or that are reinforced or that are enhanced when you're in the military, I think are invaluable to being in Congress. You got to be tough in Congress. You got to let things roll off your back. You got to learn how to jump and how high, but also you got to learn when to hold the line. And you got to learn when to hold people accountable and how to do that in a way that isn't nasty, it isn't personal, but it's focused on the policy, it's focused on the mission, and it's focused on helping the American people.
Yeah. Well, Congresswoman, thank you again. Thanks for your service and thanks for your continued service in Congress. We really appreciate all that you've done for our country. And thanks for joining us on this Veterans Day.
Well, it was my honor to serve in the military, and it's both an honor and humbling to be able to serve in Congress.
Great.
So happy Veterans Day.
Yes, thank you. Well, thanks for listening to this great story on Veterans Day of just one of many veterans who choose to serve us. And that's one of the great things about America is that, you know, for decades now, we have not had a draft. It's an all volunteer force, and people continue to choose to serve our country. And Congresswoman Miller-Meeks is no exception there. A long tradition of service, whether it was her dad in the Air Force or her in the Army. And so it's with great honor that we all honor our veterans today on Veterans Day. And thank you for your service. To honor those veterans, even civilians can do things every day to honor our military, the men and women of our United States military. And that's to help defend freedom and liberty. The only way it doesn't have to be serving in the military isn't the only way that you can defend freedom and liberty in America. You can do it many other ways. And one way you can do it is by helping Americans for Prosperity and joining Americans for Prosperity and continuing to go out and work to keep liberty and freedom alive. And that's an important thing. And I hope that you will do that. If you'd like to get connected to an Americans for Prosperity state chapter, be sure to email me at jeff@americanpotential.com. We'd love to get you connected to a state chapter. And, you know, we are always looking for great stories. If you'd like to fill out our share your story section, you can go to the americanpotential.com website, click on share your story, and you can fill that out and tell us about an amazing story of an American out there reaching their potential. So thank you for listening. Go out there, defend freedom and liberty. Thanks for joining us on this great Veterans Day.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.